Each fall, the start of the annual flu season is as predictable as the changing colors of the fall leaves. Getting a flu vaccination has become a routine part of winter preparation for many Americans. This presentation isn't about the common seasonal flu. This talk is about preparing you for a pandemic event. Unlike the typical flu season, a pandemic flu event has the real potential to cause global illness and widespread death. Such an event would be expected to overwhelm our healthcare systems and to have potentially catastrophic effects on business and commerce. Because of this, our government's health agencies have asked corporations and businesses to make special plans to prepare for a pandemic. I'm Dr. John Anderson, an occupational medicine specialist with Concentra Health Services. In this presentation, I will discuss what a pandemic flu event is and how it differs from the usual flu season. I will be discussing ways to help reduce your risk of catching the flu during a pandemic. What is a pandemic and why the immediate concern now? A pandemic refers to a worldwide outbreak of a new strain of flu virus that infects millions of people around the world. In some cases, or working in an isolated location at work and away from others may also be feasible. What are some of the early symptoms that can present with the flu? Sudden onset of a respiratory type illness and fever over 100.4 degrees, with an exception in elderly adults who may not have a fever at all, and an associated cough, plus one or more of the following: sore throat, aching joints, muscle weakness or achiness, diarrhea and vomiting, which is more commonly seen in children. Having some of these symptoms doesn't necessarily mean that you have the flu, since other illnesses can also cause these symptoms. How to distinguish influenza from a common cold? Well, a cold seldom causes a fever, headache, or aches and pains, all of which are generally accompanying the flu. The flu causes extreme fatigue, which is rare with a cold. Watery eyes and runny nose rarely present with the flu, but are almost always present with a cold. What are some of the things you can do to prevent getting the flu? There are some very basic and simple measures that should be practiced by all of us, at all times, since, as we now know, we may not be aware of being contagious before the flu symptoms develop. There are other common sense healthy practices that may hedge your bets against getting the flu. Buy an N95 mask and keep it handy to wear in situations where you are concerned that you may be exposed to the flu. This mask can be purchased through your Concentra clinic. Make sure you read the instructions carefully, since unless you wear the mask properly, it can't effectively protect you. What about antiviral medications? In summary, no one can accurately predict when the next influenza pandemic will occur, or whether it will have a relatively mild or a virulent course. By using common sense and safe hygienic etiquette, we can all help reduce the spread of the flu. Remain aware and stay healthy. The materials and recommendations were compiled from a number of sources, including the Centers for Disease Control and the World Health Organization. Specific recommendations may change over time based on numerous variables such as influenza virulence, availability of vaccinations, and antiviral medications. It is recommended that you consult with the Centers for Disease Control, World Health Organization, public health agencies, your Concentra physician, or your personal physician and other sources when needed to clarify recommendations.